Bismillahirrahmanirrahim. The next topic of our discussion is celiac disease. So, celiac disease is an immune mediated enteropathy which is triggered by the gluten present in the cereals. Enteropathy means a disorder of the intestine, and the cereals include wheat, rye, barley, and oats. These cereals contain a specific protein which is known as gluten. Gluten is the causative entity in the celiac disease. So gluten is actually a protein which is formed by glutenin and gliadin. Gliadin is the main component of gluten which results in the celiac disease. So coming on towards the pathogenesis. The pathogenesis of celiac disease is rather complex. The genetic and environmental factors and the immunity together play a role in the pathogenesis of celiac disease. So the disease begins with the ingestion of gluten within the diet. This gluten in the digestive tract is digested into a component of gluten known as alpha gliadin. This alpha gliadin is a 33 amino acid peptide which is resistant to the degradation by the GIT enzymes. So this intact alpha gliadin induces the production of interleukin 15 by the enterocytes. This interleukin 15 activates CD+8 T cells and also cause their proliferation. These activated CD+8 T cells express a specific protein known as NKG2D protein on the surface. So once this protein is expressed on the surface of T cells, they become cytotoxic. So these cytotoxic T cells identify the enterocytes exhibiting a specific component known as MICA. This MICA is actually a protein that resembles HLA class 1 proteins. So these CD+8 cytotoxic T cells kill the enterocytes that exhibit MICA, causing a disruption in the intestine, hence damaging the mucosa of the intestine. So far, the only role of gliadin is the activation of CD+8 T cells, causing damage to enterocytes. So once there is disruption in the intestinal mucosa, the 33 amino acid peptide gliadin crosses through the damaged enterocytes into the tissues. This gliadin is deamidated. Deamidated means that the glutamine present in gliadin is converted into glutamate with the removal of carboxyl group. So this glutamate is actually negatively charged. This negatively charged glutamate has a high propensity for the antigen presenting cells. So this deamidated gliadin binds to HLA DQ2 and DQ8 present on the antigen presenting cells or APCs. The antigen presenting cells here are the intestinal macrophages. So once the deamidated gliadin binds to HLA DQ2 and DQ8 on the antigen presenting cells, these antigen presenting cells present the gliadin to CD+4 helper T cells. These helper T cells do not cause the damage directly, but rather they release certain inflammatory mediators, which results in the recruitment of inflammatory cells to the intestinal mucosa. These inflammatory cells include lymphocytes, macrophages, and eosinophils in certain cases, which cause damage to the intestinal mucosa. One more thing to remember here is that the release of inflammatory mediators also activate B lymphocytes. So B lymphocytes produce certain antibodies against the trigger and self-antigens. The antibodies produced by the B lymphocytes include anti-gliadin antibodies, which is produced against the trigger, and the self-antibodies include anti-tissue transglutaminase antibodies and anti-endomysial antibodies. So the damage to intestinal mucosa results in loss of intestinal villi and malabsorption of certain vitamins and minerals. So a quick recap about the pathogenesis. The first thing is the ingestion of gluten. Gluten is broken down into gliadin. This gliadin activates CD+8 T cells, which damage the enterocytes, causing disruptions in the intestinal mucosa. Through these disruptions, the gliadin enters the submucosa and binds to HLA-DQ2 and DQ8 on the antigen-presenting cells. These antigen-presenting cells present the gliadin to helper T cells, which recruit certain other inflammatory cells. These inflammatory cells cause damage to enterocytes and also produce certain antibodies, which include anti-gliadin antibodies, anti-tissue transglutaminase antibodies, and anti-endomysial antibodies. The biopsy is taken from mostly the second part of the duodenum or proximal jejunum, since these two sites are more severely damaged in the celiac disease. The histological picture reveals increased intraepithelial cytotoxic T cells. Moreover, other inflammatory cells are also present in the upper part of lamina propria. These inflammatory cells include plasma cells, mast cells, and eosinophils. The characteristic finding in celiac disease is atrophy of the intestinal villi. Villi are actually the finger-like projections present in the intestine. The atrophy of the villi makes the surface of small intestine smooth. As you can see in this picture, there is complete loss of villi, making the surface smooth. Moreover, there is hyperplasia of the intestinal crypts. These are the hyperplastic intestinal crypts. Celiac disease has a diverse presentation. It could either present in the children at the introduction of cereal food. Disease in the children typically presents between age 6 to 24 months, and the chief complaints are failure to thrive or failure to grow and weight loss. There might also be a history of diarrhea and bloating. In the adults, the disease might present between age 30 to 60 years, and the chief complaints are chronic diarrhea, bloating, and the secondary effects of celiac disease due to mineral and vitamins deficiency might also be present, such as megaloblastic anemia due to failure of vitamin B12 absorption, iron deficiency anemia due to lack of iron absorption. The diagnosis is established on the positive serology and histological features of the disease. The antibodies detected in the celiac disease include anti-tissue transglutaminase antibodies, anti-endomysial antibodies, and anti-gliadin antibodies. The most specific antibodies are anti-tissue transglutaminase antibodies with their sensitivity greater than 95%. The endoscopic evidence also reveals patchy villus atrophy in the second part of the duodenum and in proximal jejunum. The only treatment of celiac disease is gluten-free diet, which results in regeneration of the intestinal villi and improvement of the signs and symptoms. Moreover, minerals and vitamin supplements are also given to counter the malabsorption. So this brings us to the end of discussion about celiac disease. If you have any questions, do let us know in the comment section. Thank you.